I'm ready.
My hands are washed, knock on the door. Hi Julie, my name's Corey. I'm an FNP student. I'll be taking care of you today. Are you all right if we record this HEENT exam when I put it on YouTube for my class?
Yes.
Okay, awesome. So first I'm just gonna start with the Hedges Inspection, look for any sort of lesions, facial symmetry, your eyes are even, eyebrows are even, doesn't look like you have any asymmetrical features. I do notice a mole here. I don't notice any lesions. And then I'm just gonna, and then hair distribution is even on the head, your eyebrows are filled in, no excessive hair growth noted. So I'm just going to palpate your scalp and your head, feel for any depressions, hematomas, or cysts. The texture of your skin looks normal, I don't notice any rashes or bumps or anything like that. The next thing I'm going to do is just run through the cranial nerves. So the first one I'm going to do is the olfactory nerve. So don't look. Okay, cover your eyes, cover one of your nostrils, and then smell this. What is that?
Cinnamon.
Okay, and then while I'm doing this, I notice that she has good air passage through her nose. Okay, other nose. Okay, smell.
Curry.
Curry is correct. We work with what we've got. Okay, so that's number one. Number two is your optic nerve. So for this one, I'm going to check your visual acuity. I'll stand 6 feet back. You can't see me. Well, I'll be 6 feet back, but go ahead and read the lowest or the smallest line.
LTFPH.
Awesome. Okay, cover your right eye. Go ahead and do that again.
LTFPH.
And then your other eye, read it backwards.
HPFTL.
Awesome. Okay, so that's visual acuity. And then I'm going to have you cover one of your eyes. And I'm going to do visual fields, just kind of checking the peripheries. So tell me when you can see my hands.
See both.
Okay, and then same thing.
Both.
Same thing.
Both.
Okay, now we're going to do it with the other side. Go and do the same thing.
Both. Both. Both.
Okay, and then look straight at me. We're going to do both eyes. Okay?
Yes. Yes. Yes.
Awesome. Okay, so there's that one. And then I'm going to go ahead and look at kind of into your eye. So I'm going to start at a 15-degree angle about, and then look out from here. And I do see the red reflex, so now I'm going to do, just make sure I'm using safety. I'll put my hand on her forehead and then brace against her cheek. And look around at that red reflex, back at the funness of the eye. The optic disc is sharp. There's no AV nicking noted. This is on the right eye. No macular degeneration noted. Everything looks good. Now I'm going to go ahead and do the same thing on the left eye. And I'm going to go left eye to left eye. I see the red reflex. Now I'm going to come in closer. And just kind of move around so you can see all aspects of that retina. And same thing, optic disc is sharp. No AV nicking noted, no macular degeneration. So that looks good. Okay. Sorry to blind you.
It's okay.
Okay, so next I'm going to be testing cranial nerves 3, 4, and 6, which is trochlear. Abducens is 6, and then, oculomotor is 3, and then trochlear, and then 6 is abducens. So go ahead and follow my finger. Try not to move your head. Okay, and then I'm going to do convergence. Follow my finger. Awesome. And then look at my finger, and then look past my finger, and then go and look back at my finger. And her pupils dilate when she looks at a distant object. And then go ahead and cover one of your eyes. And then don't move your head, just look at my finger. Now uncover your eye. Perfect. And then cover the other eye. And do the same thing. Uncover. Awesome. And that shows conjugate gaze, just showing that one eye isn't trying to keep up with, or they're both keeping up with each other, even if one's closed. So next I'm going to look straight ahead. I'm going to look for any foreign bodies. You can kind of tell shining sideways. I don't see any of that. No glaucoma. Stuff I could have mentioned a little bit earlier. I was looking in the eye earlier. And then I'm going to just check for direct and indirect pupillary response. So just look straight at my nose and pupils constrict, and then I'm looking at the same pupil I shine the line, that's direct, and then indirect is when I look at the opposite pupil, and that also constricts. So I'm going to do that on the other side. Awesome. So that looks good. Those pupils are equal, round, and reactive to light. Next, so that's 3, 4, and 6. And then the next thing I'm going to do is, and then 5 is trigeminal. So I'm going to have you do some facial movements. Go ahead and smile. That's facial. So we're not going to do that one. We're going to try trigeminal first. So go ahead and close your eyes, and I'm going to do, and you can actually look, I'm just going to kind of poke you with something sharp, and then I'm going to dab with something soft, okay? And then I'll just do it. You tell me if it's sharp or dull or soft, and just tell me where you feel it on your face, okay?
Okay.
Okay.
Sharp jaw.
Uh-huh.
Soft forehead. Soft jaw. Sharp cheek.
Sorry.
Soft cheek.
Which side, sorry?
Right.
Okay.
Sharp left forehead.
Awesome. Okay. Perfect. So that is, let me just get my stuff, sorry. Okay. One thing we could do is the corneal reflex. We're not going to do that, but that's where you would just take a cotton ball and kind of touch it to the outside of your sclera there, and then you would see that corneal reflex. And then for the trigeminal, I'm going to also go ahead and test temporal and masseter muscle strength. So go ahead and clench, and then open your mouth, checking for TMJ. Awesome. And then we've already done 6. 7 is facial, so that's why I'm going to have you do those facial movements. So go ahead and puff out your cheeks, smile, blink, raise your eyebrows. Did you already puff out your cheeks? Okay. And then, and we already checked the other facial sensations. And then next will be 8, which is vestibulocochlear. I'm going to be testing hearing. So first I'm going to have you just cover your right ear for me, and then tell me what 2-syllable word I'm whispering.
Apple.
Okay, now other side.
Baseball.
Okay, perfect. If there's any sort of hearing impairment, or if I could notice that just as we were talking, we would also do the Weber and Rene test. The Weber test is where you hit. Sorry. And then tell me if you can hear on one side or both.
Both.
Okay. And then tell me when you stop hearing through the bone.
Yeah.
Okay. Can you hear that?
Yes.
Awesome. And that's because air connection is greater than bone connection. I'm going to do the same thing on this side. Tell me when. On the mastoid process.
Yeah. Yes.
Awesome. So that's perfect. So that's Weber and Rene. And then the next one I'm going to do is 9 and 10 is glossopharyngeal and vagus. And for that one, I'm going to have you, gotta look at all my stuff, make sure I have all my stuff out. Oh, that's what I need this. Okay, so go ahead and say ah. Okay, and I see the soft palate and the uveal raise up, which is good. While I'm looking in the mouth, I'm gonna go ahead and look at the buccal mucosa. Looks pink and moist. On the back of the throat, her tonsils are a little bit swollen. I'd say 2+. They're also red. The back of the throat is red. You do have a little bit of postnasal drip back there. And then the papillae on the tongue are normal. They're not like enlarged or red or swollen or anything like that. Under the tongue, you can look at the salivary ducts. Don't look swollen or red or inflamed. I can also look at dentition. I do notice just one silver cavity or filling on that side. Everything else looks pretty good. No redness on the hard palate. The lips are pink and moist. The next thing, and then with, while I'm doing that, you could do a gag reflex. We're not going to do that. You're welcome. And then go ahead and cough and swallow. Perfect. So you've got those intact. Next, I'm going to do number 11, which is spinal accessory. So that's going to test the trapezius, so lift up, perfect, and then turn against my hand, and against my hand, that's the sternocleidomastoideus muscle. And then the last one is going to be the hypoglossal, and so go ahead and stick your tongue out, and then side to side, and you can assess tongue strength, and that's all normal. So, thank you, that was the whole cranial nerve assessment. So next I'm just going to be looking at your eyes a little bit more. So I just see that the conjunctiva are pink and moist. There's no redness. Lacrimal glands don't seem to be swollen. It doesn't seem like you're having any accessory tearing. And then no foreign bodies, like I mentioned. The eyebrows are nice and symmetrical, no dry skin or anything like that. Okay, next I'm going to be pressing onto your, so this patient came in with a complaint of a sore throat. I guess I could have started with that. But, so I'm going to be pressing on your frontal sinuses. Any tenderness or pain?
Yeah, it hurts.
Okay, and then how about right here?
Yeah, those hurt.
Okay, so a little bit of pressure in the sinuses. And then I'm going to be palpating your nose. Is it sore at all? Not too bad. Okay, and then I'm going to be looking. Give me just a minute while I switch out my ophthalmoscope head here. Okay, so I'm going to be looking into your nose. Not the most comfortable thing. Okay. So I'm just going to be, so with safety, you can put your hand against their head and then also your finger there, right into the front of the nose. Okay, it is a little bit red. Turbinates are a little bit swollen, but I don't notice any polyps or any major drainage. Are you a little congested?
Mm-hmm.
Okay, and then we're going to do the other side. Sorry. Same thing. It does look like air is able to pass through. Does that sound right?
Mm-hmm.
Just still kind of congested, maybe further back.
Yeah.
Okay. Awesome. Okay, so that is your nose. Next, I'm going to take a look at your ears. Switch out my specula head here. Okay, so we already did we already checked for hearing. Now I'm just going to kind of palpate a little bit. Any tenderness?
Mm-mm.
Okay, how about on this side?
Mm-mm.
Okay, and then I don't notice any like major external discharge, but I am going to go ahead and look into the ear canal. And I'll show you better on the other side, but I'm bracing with my hand and then my other hand also, so if I get bumped, it's not jabbing into that ear canal. So just looking deep in, the ear canal is nice and pink. Just looking around the tympanic membrane, it's pearly gray. You can see the malleolus handle, you can see the incus behind it. Cone of light on the right ear is at 5 o'clock. So everything looks normal in your right ear. We'll do the same thing with your left ear. Doesn't look like you have any discharge, no major redness, I notice. Pink ear canals. Okay, same thing, pearly gray tympanic membrane. And cone of light is at 7 o'clock, which all of that's normal. So your ears look good. And then I'm also going to, we already kind of assessed the mouth, so then we're going to move down to the neck. And I've already assessed symmetry on the neck, looks good, no lesions really noticed. You can do some range of motion here. We already kind of turned against and against. Now turn just on your own side to side. Push your ears and then extend the neck and flex it. Okay, any pain or discomfort?
No.
Awesome. So now I'm just going to palpate the trachea and you can actually just place it from side to side. Okay, it's nice and symmetrical. You can fill in this notch here, just nice and even. It's not displaced to one side or the other. Then the next thing you can do is just go from behind the patient and feel down the neck onto that cricoid cartilage. And then right below that is the isthmus of the thyroid. And then on either side are the lobes. So go and take a swallow for me. Okay, and you can feel that slide up between the fingers. Any pain or discomfort with that? Okay. And that conclude. And then I'm gonna just, okay, oh, one more thing with the neck. I'm just going to, I've kind of been palpating the neck, but I'm just going to check for lymph nodes. So preauricular right here, postauricular, coming down, submandibular, submental. You do have a little bit of swelling here in some of your lymph nodes. So those can sometimes be palpable. Yours are pretty swollen. And then anterior cervical, posterior cervical, supraclavicular, and then occipital. So those all feel good. Supraclavicular are some of like the most concerning ones, but everything else looks good. And that concludes our video.